Hey everyone, welcome back to my YouTube channel. Today we are going to talk about occipital bone. So let's start the topic with introduction, and here at the side you can see the diagram representing the skull, and the green portion of it is occipital bone. So occipital bone is posterior component of skull that is critical for encasing brain occipital lobe and forming the base of the cranial cavity. It is distinguished by a combination of robust structural traits and artistic curves that contribute to both its protective function and its involvement in head movements. Understanding the occipital bone is essential for clinicians, surgeons, and anatomists as it structural aids in diagnosing cranial injuries and planning surgical interventions. Now let's talk about location and structure of occipital bone. Occipital bone forms the back and lower part of skull. It is positioned between the parietal bone above and temporal bone laterally, and it connects inferiorly to the first cervical vertebra through atlanto-occipital joint. Its structure is complex, comprising several distinct regions that serve varied function in cranial architectures. Now let's talk about key features of occipital bone. The first feature is foramen magnum. This is the largest opening in the skull and is centrally located in the occipital bone. It serves as a passage for spinal cord connecting the brain to vertebral column. Its size and location are critical for maintaining the alignment of neurovascular structures as they transverse from the brain to the spine. Second key feature is occipital condyle. That is flanking the foramen magnum or the occipital condyles. These rounded protrusions articulate with atlas, that is the first cervical vertebra, allowing for the nodding motion of the head. This morphology is vital for stable yet flexible head movements and is a focus in both forensic analysis and clinical diagnosis of craniovertebral junction abnormalities. Third key feature is external occipital protuberance. Often palpable on the posterior aspect of head, the external occipital protuberance that is commonly known as inion is served as the attachment site for nuchal ligament and several neck muscles. Its prominence is sometimes used as reference point in anthropological and clinical assessments. Next key feature is nuchal lines that are running lines laterally from the external occipital protuberance are the superior and inferior nuchal lines. These ridges provide additional attachment sites for muscles and ligaments that facilitate head movements and posture, underscoring the occipital bone's contribution to musculoskeletal system of head and neck. Next feature is squamous and basilar part. Occipital bone can be divided into squamous part, that is posterior part, and basilar part, that is anterior part of occipital bone. Squamous portion forms the curved back of skull, while the basilar part contributes to the cranial base and directly interfere with sphenoid and temporal bone. This dual nature allows the occipital bone to fulfill both protective and functional roles. Now let's talk about embryological formation of occipital bone. Occipital bone undergoes a complex developmental process primarily through endochondral ossification. During embryogenesis, a cartilaginous precursor gradually transforms into bone. The occipital bone starts as several separate ossification centers, which ultimately fuse to form a single bony structure. This fusion is typically completed during early childhood, although minor variation in the timing of suture closure can exist individually. Now there is postnatal growth. During postnatal growth, the occipital bone adapts to the rapid development of brain and demands of head movements. This presence of open suture in childhood facilitates expansion, ensuring that the cranial cavity can accommodate growing brain structure. As the individual matures, these sutures gradually ossify, providing a rigid and durable structure that supports both protective and mechanical functions. Now let's talk about functional significance of occipital bone. The first functional significance is its protection of vital structure. As one of the primary roles of occipital bone is to safeguard the brain, particularly the occipital lobe and cerebellum, as well as brainstem. The robust nature of this bone combined with its strategic position often considered protection against external trauma and mechanical stress. Second functional significance is its role in craniovertebral articulation. As the articulation between occipital condyles and the atlas is fundamental to head movements, These joints enable the nodding and slight rotational movement of head while ensuring stability at craniovertebral junction. Its health is critical for maintaining proper alignment and function of upper cervical spine. Third functional significance is muscle and ligament attachment. As the occipital bone often have several anchorage points for muscle and ligaments responsible for head and neck movements. The nuchal lines in external occipital protuberance is particular serve as a site where vessels responsible for extension and rotation of head are attached. The anatomical arrangement is essential for both voluntary and reflexive movement, reflecting the body's integration into musculoskeletal system. Next clinical significance is traumatic injuries. As the occipital bone, due to exposed location at the rear of the skull, is frequently subject to the trauma. Fractures or depression in this region can have severe repercussions, including damage to the occipital lobe, brainstem, or craniovertebral junction. Radiological imaging such as CT scanning is essential for evaluating the extent of these injuries and planning appropriate interventions. Then it also has neurological impact because of the foramen magnum that serves as a conduit for the spinal cord. And any deformity or structure involving this occipital bone can have significant neurological consequences. Conditions such as basilar invagination, where the upper cervical vertebra move upward into the foramen magnum, highlights the delicate balance maintained by this bone. Neurological symptoms may result if the pathway is compromised, emphasizing the importance of early detection and treatment. Now let's talk about the surgical significance of occipital bone. In neurosurgery and craniovertebral junction surgery, detailed knowledge of occipital bone morphology is paramount. Surgeons must navigate around vital structures including the foramen magnum and occipital condyles to address conditions like tumors, fracture, or congenital abnormalities. Advances in imaging and surgical planning techniques have further refined the approach to procedure involving its critical bone, reducing risk and improving patient outcomes. Now let's talk about the conclusion of all this lecture video. Occipital bone is cornerstone in human skull, fulfilling multiple roles that range from protection of brain to facilitation of head movement. Its intricate anatomy with features such as foramen magnum, occipital condyles, nuchal lines, and external occipital protuberance underscore its importance in both structural integrity and functional dynamics. A comprehensive understanding of the occipital bone is essential for medical professionals, enabling precise diagnosis, effective treatment of cranial injuries, and advanced surgical planning. So this was all about occipital bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.